James Golden Show on the Red Apple Podcast Network.
Ladies and gentlemen, we are pleased to have Dr. Peter Michalos with us again. We talked 2 weeks ago, and he really, wow, what a session. And at the end of discussing America's health care, this is going to be a continuing discussion, I hope, with Dr. Michalos, because we can't get it all in one show, 2 shows, or 10 shows. It's a continuing discussion because it continues. Now, before I bring in Dr. Michalos, I want to play something from the House this week, a House hearing. Representative Greg Cesar was trying to nail R.F. Kennedy Jr. on Obamacare. Let's cut 33. Let's listen in on this exchange.
Have you met with any of the 1.4 million people who have lost their health insurance just this last year from dropping off of Obamacare? Have you sat down and talked to those folks about the fact they won't have their health insurance again?
They're almost all illegal immigrants.
Oh, well, you know what? It sounds like you haven't met with folks like Portia in my district.
We found 1.5 million illegal immigrants illegally collecting Medicaid.
Mr. Secretary, there are people like Portia in Buda, Texas, whose health insurance costs went from $100 a month to $500 a month. People like my constituent Shauna in San Marcos, Texas, her premium went from $250 to $750 a month. Now, $500 a month may not be a lot to you or to some of the billionaires that y'all are talking to, but for these moms with kids, they've lost their health insurance this last year. So have you had a conversation with, how many people have you sat down with that have said, Mr. Secretary, I lost my health insurance this last year. What are we going to do about it?
87% of the people who are on Obamacare are paying less than $96 a month. 54% of the people who are on Obamacare today are paying less than $50 a month.
Well and good for us to talk about Obamacare policy.
And by the way,
question is, it sounds like the answer.
Democrats had 3 chances to make.
We could talk all we want about the past.
Tax credits.
We could talk about.
Why didn't you do it?
We could talk about the past.
Why didn't you do it when you had the power to do it?
Mr. Secretary, just like you, I'm new here. I'm responsible for what's happening right here and now.
Yell at your colleagues.
My question, Mr. Secretary, is: have you met with anybody that's lost their health insurance? And it sounds like the answer is 0.
This is typical of what you get from Democrats. They just they want talking points. They don't want to really solve anything. Let's just do this. Let's just do that. Now, this is one of the reasons we asked Dr. Michalos to come back, because when we were last talking, we talked about people who were losing their health care coverage. And I asked Doctor, please help us figure out what are the solutions to all of this. So, good morning, Dr. Michalos. You heard that dialogue. You heard people losing health care. Health care is in a mess in this country, and it seems that neither party can put together what's necessary to fix it. And I know talking about fixing health care is not something that we may be able to do in just a half an hour, 2 or 3 hours, because it's so complex. But where do we start, Doctor? Good morning.
Well, good morning, Bo, and it's great to be on what I call the truth center of radio, and I'm glad that you brought up that clip because, again, it's always out of context. They don't give you the history of exactly what is going on, and the reality is that in this country, we have something called the EMTALA Act, Emergency Medical Transportation Labor Act, which basically nobody is refused care in this country if you go to an emergency room. And if you have a real problem, no one gets turned away based on their ability to pay. So unlike other countries, like people think, for example, in China, that there's a national system or it's communist. No, if you don't have money in China, you don't get care, or in a lot of countries. Here in this country, we treat everyone. There are safety nets. And also there are so many middlemen getting a cut in this country, which is part of the problem. Now, getting to the Obamacare in that clip, Obamacare came in and it had the way they made it cheaper and it made it great for the insurance companies. The insurance company got upfront money, but then the patient got a $5,000 deductible. So all these young people and a lot of these people who had these high deductibles with Obamacare, never met their deductibles. So then it turned all the doctors' offices, the mom and pop doctors' offices, into collection agencies because they had to go and put people in collection, destroying the physician-patient relationship. Everybody was mad and found out they had these cards without care. So all these young people ended up with their credit ratings ruined because they went into collection. And nobody likes to talk about the nasty little secret that the number one cause of bankruptcy in the United States is medical. So there is a problem there. And the way there are solutions, and part of the problem is it costs a lot of money to practice medicine and to give medicine, and for hospitals too. We don't have tort reform in this country, so that means lawsuit reform. And it's, for example, in some areas in New York and Florida, it's $250,000 to get insurance just to be a neurosurgeon, or $180,000 if you deliver a baby. So all that cost is factored in. Then you have the enormous amount of paperwork that's created, what we call in medical offices, all these uncompensated administrative burdens and theft of services with all this additional paperwork. And then everything you do, you have to get, for example, pre-certification. You want to get a CAT scan, someone had a brain tumor, and then you have to hire somebody and pay them $30 an hour, and then to get a scan could take 2-3 days, but the person is very sick. The other big thing that we need to have is transparency in pricing. Why does it cost $3,000 to get an MRI in a hospital, but I can go to a private MRI center and basically if I say I have no insurance, it's only $300 and you can pay in cash. So just like everything else where you have prices in a grocery store, in a supermarket, whether you buy a car, there needs to become a national effort to show transparency. So that's one of the best ways to have competition. And these other people they mentioned, their insurance went from 100, 200. There's also programs that were set up that millions of people participate in, called these Christian health sharing programs. And you don't have to be a Christian to join it, but it was set up. There's no middleman or insurance person, and they're only about $200, and I know many people who are in their 20 when they turn 26 and they lose their insurance. I told them about it, and they're so happy. And there are these health sharing programs, and basically they negotiate. If you have an appendix, you're not going to end up with a $150,000 bill. They negotiate with the hospital. They get the best rates. They help you get fair priced drugs and medicines. And these people they're talking about, their insurance went from 100 to 500. There are other private options that you can do. The other thing we need to do is risk adjust a lot of these programs. If you're a smoker, for example, you should pay 20% more for any insurance or coverage that you get. Just like if I'm a bad driver, I pay more. If I'm a doctor who's been sued 3-4 times, guess what? My malpractice will be higher. So that's one of the things that we should be doing to incentivize people to be healthier. In addition, we need to strengthen primary care, because if we have better primary care, the people who are diabetic or the people who are overweight can get access to health care right away to help them lose weight, to help them with smoking cessation, to help them get their cholesterol and high blood pressure under control. And that automatically will save billions of dollars in the system by having more access to primary care. And people have trouble getting access to care now because what's happened is that when Obamacare started destroying all the mom and pop practices, hedge funds came in and they bought large groups. So you go into a community, there's a certain health system that controls the 100 internists or the 100 family practitioners. Try to get an appointment. And oftentimes what they do is they push you to a nurse. They're very fine people, nurse practitioners, physician assistants. You rarely ever get to even see the doctor to get down to the actual issue that's happening. So that has made access to care much harder. Go into any community unless you have the ability to pay for a concierge or a private doctor. And that model started coming up because people couldn't get access to care, couldn't get access to specialists. They tell you 4 or 5 months. When a doctor was private, they would say, come on down. Once they're a salaried employee and they're pushing 30, 40 patients a day, it's very hard to get in a same-day appointment or 5-day appointment. And that's what caused all these urgent care centers to pop up all across the country, because people were frustrated and they would go in, and usually they're more fair priced. And they came in very handy during COVID because they did a lot of the frontline testing for COVID, flu, strep, and people were able, and it was starting to replace health care that you used to have with your mom and pop doctor. But unfortunately, that model, they put us out of business because between the insurance costs, staffing costs, and everything else, it wasn't possible. So there are solutions, and also an option that allowed to compete with private insurance. I would call it fair care, and you pay into the system. And everyone tries to make out Medicare for senior as an entitlement program. It's not. We paid 2.9%. So if you made $100,000, you paid $2,900 from the day you got your first job, and you've been paying into that system. And everybody complains about the millionaires and how bad they are. A guy who's makes $1 million a year has been paying into that system for many years, 2.9% of that, all these years, $29,000, and they probably never even use it. So we need transparency. Where is all that money that we've been collecting? And that's what DOGE should be looking at. All the money that you collect from Medicare, where is it actually going? Is it actually going into the healthcare system and not making everyone feel bad? Oh, we need to, cut services or cut Medicare. And Medicare is very important. It actually helps a lot of seniors getting the care that they need. In the old days, when people had pneumonia or TB, they didn't seek out care because they would go bankrupt. So it is a good system for seniors. But again, it's not an entitlement system. We've been paying into that system. We also need to expand telehealth coverage for people in rural and poor areas, because a lot of times, sometimes you just need a medication renewal. That was a big problem in the VA system that I've actually seen, where they ran out of their insulin or their psych meds, but the VA centers were closed on weekends. The good news is that the current administration helped that, and they opened up all these different centers so people can get access and actually go to an urgent care center, get your medication, your insulin, your psychiatric medicines. So these are part of the solutions to improve the system.
Well, I need you to just hold there for one moment. We got to take a quick break. But, okay, I got a few things. How do we make some of this stuff actually happen? When we get back, just think about this. Because it's not going to come from Congress. It's not going to come from anyone in... People in the medical profession are going to have to get together and put forth the plans to fix this. And that, I know, involves some self-interest. But it's not going to come from Congress, because they're getting paid by the insurance companies to keep the insurance companies wealthy. So we got that. And then I have a question that came in from Nursey Nurse. On a different matter, but what happens to those who were healthy but now, because of the jab, are seriously injured or unhealthy? Why should they have to pay for more insurance for something that was pushed on them? So I had two questions for you when we get back. James Golden, Snerdley, and Dr. Michalos is with us, thankfully. And we're going to have him back continually, folks, because as I said, we can't just do this in a half hour, an hour, days. But these are continued discussions. But we have two questions and we have 5 minutes. What happens to those who are healthy now, but because of the jab, the vaccines, they're seriously injured now? They're unhealthy. Why should they have to pay more for insurance when these vaccines were pushed on them? That's one. And the second is, how do we get these changes done? Because Congress is not going to do it. I stand aside and give you the floor, good doctor.
Okay, well, let's first start off that we got emergency authorization for vaccines, and in this country we were pushing for vaccines to fight the pandemic. Other countries were focusing on pills, antivirals, to block viral replication, which blocks every kind of variant. The problem is every time we made a vaccine, this RNA virus kept mutating, and it kept changing, So people kept getting sick. For example, in countries like Singapore, Russia, Vietnam, Japan, Turkey, they had favipiravir, which is an antiviral that was developed in Japan, and they were using it. And guess what? Their death rate was a lot lower than ours, and it took us a long time before we had pills. And then they suppressed the use of hydroxychloroquine, and now the studies came out that no, it does not block viral replication, but it blocked the inflammation called the cytokine storm. And they were pushing the study, and they were in veterans, but they gave it to them 3 weeks after they started COVID. Instead of giving it the first 3 days, they showed it suppresses inflammation. So that information and a lot of misinformation ended up killing a lot of people, whereas we should have had access to antivirals early on and immediately, just like when we get the flu. We take Tamiflu. It works great, still works great. It even works for these new bird flus. So that's one of the problems, right there off the bat that happened with that. As far as the COVID injured people, we have a big problem in this country. Another dirty little secret is basically millions of people ended up filing for disability because with long-haul COVID, they have brain fog, they can't concentrate, they get this weird condition in their heart where their heart starts going super fast and super slow. They feel dizzy, tired, headaches, and constantly fatigued, and there is no good treatment right now. There are long-haul COVID centers that have opened around the country. And yes, it's a problem getting coverage when you go and ask and your insurance rejects you when they order certain blood tests to check inflammation levels or COVID titer levels. So that it is a problem in the system. And like you said, one of the solutions is, the privatization. And I'm not going to mention the names of the companies of these health sharing programs because they can always buy ads on your great show, but they exist and they're health sharing programs that people who don't have insurance or underinsured can get them, and it's very inexpensive because you've gotten rid of the middleman. For example, the insurance companies that are all sitting in Connecticut getting their 30% cut. Nobody gets a cut. It's direct. It's dealing direct, transparency in pricing, and those are the solutions. So there are solutions out there, but more people need to know about them, and basically direct payment to the providers and bringing down the prices and getting rid of the middlemen, just like they did with TrumpRx.org was brilliant. They got rid of the pharmacy benefit managers, which were middlemen. So some medications that were $1,000 a month went down to $250 a month. And again, some people, may or may not like Amazon, but what Amazon's done is great, where they actually have an Amazon pharmacy. And I just looked up some of my medicine, and if I were to buy it now without insurance, it's only $5 a month for my blood pressure medicine. So people need to look at those alternatives. And you're right, it needs to be a private, organized effort. The problem is there are very few private doctors left. They're all working for some larger entity or system because of the damage that was done by Obamacare and putting out the small mom and pop shops around the country.
Wow. Doctor, thank you. You're coming back, please. And we're going to continue these discussions, okay?
Thank you for always getting the truth out, Bo, with compassion and good humor and getting all the facts out so that people can have some actionable data and make proper decisions. So stay healthy, live long and prosper, think positive, and test negative.
Boom! I love that close. Princess Di's coming up in the next hour. Hour number duo in the can.
Thanks for listening to The James Golden Show. You can hear The James Golden Show Saturday mornings at 7. If you like the podcast, share it with your friends and listen anytime at WABCRadio.com and download the WABC Radio app. Hit that subscribe button on all major podcast platforms. Plus, follow WABC on social on Instagram, TikTok, Facebook, and X. See you next time for a new episode so you never have to wonder.
What the heck is going on here?